In this video, I'm going to use this diagram to illustrate the earliest and best time to take a pregnancy test to avoid false negatives. Now, before a pregnancy test can be positive, implantation must happen. So let's go over what implantation is with this diagram. Now, this is a diagram showing the female reproductive organs. This is the vagina. It is what receives the penis during intercourse. This is the cervix. It is the mouth of the womb. It opens slightly during period to allow period blood to pass through and opens fully during labor to allow for the birth of the baby. Now this is the uterus. This is where the growing baby develops during pregnancy. These are the fallopian tubes and these are the ovaries. And you will see that inside the ovaries, we have these small cycles with dots in the middle. So those cycles are called follicles. And inside those follicles, we have fluid. And then eggs are suspended inside that fluid within the follicles. So the ovaries store eggs in a woman's body. Now, before implantation can happen, fertilization must first happen. And before fertilization can happen, a sperm must meet the egg. Now, every month, the ovary matures an egg. You see these cycles, one of them grow very big. And when it is fully matured, it will burst. So when it bursts, it releases that fluid so that the egg can come out. That process is called ovulation. So ovulation is the process of release of a matured egg from the ovary. Now, when the egg is released, let's say this red dot here is our released egg. When this egg is released, it is received by the fallopian tube. You see this finger-like end of the fallopian tube, it receives the egg. And when the egg enters, it moves for a short distance and then stops and waits for the sperm. Now, during intercourse, millions of sperm cells are deposited here. They enter the uterus through the cervix and then they go to the fallopian tubes. So now our egg is here waiting. And let's say this was the fastest sperm cell. So it comes, fertilizes the egg, and then the fertilized egg becomes a zygote. So that day of fertilization is called day one because that fertilized egg, the zygote now, is going to move into the uterus over the next 5 to 6 days. So it moves, this is day one, then it moves a little bit, and then this is day two, then it continues moving, this is day three, then it moves again, this is day four, and then by day five, it enters the womb. So now the fertilized egg is in the womb, which is the zygote. But at this stage, we don't call it zygote anymore. We call it a blastocyst because division already starts happening inside the fertilized egg. So it is called a blastocyst at this stage. Now, by day five, it is in the womb. The next thing it is going to do is it will attach to the wall of the womb. And that is what we call implantation. So it will start developing these finger-like projections that are going to penetrate the wall of the womb so that it can attach firmly. So think of it like the roots of a plant, how they attach the plant firmly to the soil. So by day 6, so this is it. It develops those finger-like projections and then it attaches to the wall of the uterus. So this is called implantation. When this attachment happens, we say implantation has happened, and so pregnancy has happened successfully. Now, after this implantation happens successfully, the body starts producing the pregnancy hormone called human chorionic gonadotropin, which is known for short as HCG. So that HCG is the hormone that will be detected when you take a pregnancy test. So you can see that I said implantation happens by day 6. So but then it doesn't happen the same day for every woman. Sometimes by day 5, even though the blastocyst is already in the womb, it does not attach immediately. It's kind of floats around, and then after a while it attaches to the wall. Sometimes the attachment can be by day 7, by day 8, day 9, but then there is an average of 6 to 10 days. So you see, implantation happens on average from day 6 to 10. So day 6 to the 10. So what this means is that when you want to take a pregnancy test, you should take it 6 to 10 days after ovulation. That is 6 to 10 days post ovulation. That is when you should take a pregnancy test to avoid a false negative. Now, there are some signs that might point to you that implantation has already happened, and they can also help you know when to take a pregnancy test. Number one is called implantation bleeding. Now, you see this attachment that happens, those finger-like projections that penetrate the wall of the uterus so that the blastocyst can be implanted. Sometimes they pierce through tiny blood vessels in the wall of the uterus. And when they pierce through those tiny blood vessels, bleeding can occur. But this bleeding is different from period bleeding because the blood that comes out is very, very small. It's not a lot, it's just mild bleeding. And sometimes you might just see it as blood mixed with mucus. It is not like the way period blood flows freely. So, implantation bleeding is one sign that can point you to when to take a pregnancy test. Another thing is implantation cramps. Now, for implantation cramps, remember I said when these finger-like projections pierce these blood vessels, bleeding can happen. Now, that bleeding, when it enters the womb, it can irritate the womb and cause the uterus to contract. So that contraction can also cause pain, and that is what we call implantation cramps. So, implantation cramps is another pointer that can point you on when to take a pregnancy test. Even if you remember only one thing from this video, remember that HCG, the hormone that you detect when you do a pregnancy test, will not be detectable until implantation has happened. And that implantation is going to happen about 6 to 10 days post ovulation. So that is the best time to take a pregnancy test. If you found this video helpful, if you learned something from this video, please like the video, share and subscribe to the channel. And you can also check out my videos on how to calculate your safe days and fertile days for those who do not want to get pregnant or even those that want to get pregnant. And also check out my videos on how to count your menstrual cycle correctly. I will see you in those videos. Until then, stay healthy and be kind to yourself.